over a lot of questions, a lot of information. I'm going to try to race through this information as much as possible. It's a good week. It's the start of another week. We've got more positive news, which is good, and I'm looking forward to sharing that with you. So just a real quick update on CAL FIRE, 93% contained. They expect full containment by Sunday. 22,750 acres burned in San Mateo County. Single family residence says damaged 4, 14 destroyed. Commercial structures damaged 1, 28 destroyed. And other minor structures, 1 damaged, 17 destroyed. Just want to give a great shout out to CAL FIRE for all the great work that they have done. They have been just terrific throughout this whole crisis, and what great partners they have been. Okay, into the numbers. County Health continues to run with unfortunately 6 more deaths since the last time we reported. We're at 142 right now, and our confirmed cases are at 9,264. That's a plus 25 from Tuesday, 66 from Monday, and 43 from Sunday. You can see the main group, it continues to be that 20 to 40, and that the Latinx population accounts for more than half of the confirmed cases, and then we have a large unknown segment of those cases. The positivity or the confirmed cases remains relatively low at 13, other 18 suspected, 0 from out of county. The ability to have ICU beds and hospital beds available is outstanding still, and our positivity rate remains very good also, as does the turnaround time. We've had almost 160,000 tested in this county to date, which is terrific. So just an update on the testing. Last Friday and last Monday, we had to cancel testing because of the air quality. And we will make up for that, and this is key. We want to keep those numbers high as far as testing. So on Saturday, this Saturday, we'll be testing at the event center. I believe we'll have 9 lanes open. We will look to try to get 2,000 people through. So there's lots of opportunity for people on Saturday to get through there. We got another, I think 900 spots open, as I think 1,100 have been filled already. So we would encourage anyone who wants testing on Saturday to go ahead and sign up now. And certainly we do take walk-ups also. So Tuesday, the 8th in Daly City, we had 596 with 139 walk-up. Wednesday, Daly City, we had 608 with 119 walk-up. Thursday, the 10th in EPA, we had 553 and 135 walk-up. And then Friday and Monday, we were closed. So next week, we're in Daly City, this week, Daly City today, East Palo Alto tomorrow, the 17th, East Palo Alto on the 18th, the Event Center on Monday, the 21st, and Tuesday, the 22nd. But this Saturday at the Event Center, we will be open and serving up to 2,000 people. So the Chief of Health, Louise Rogers, kind of laid out the blueprint. And as a reminder, there's tiers now created that everyone knows about from the state. We, when that rolled out on August 31st, we were in the purple tier, which is the widespread, the most restrictive. And that was a case rate of 7.8 new case per 100,000. And the unadjusted rate was 7.7, and it's based on a population of 778,000. And that's a 7-day average with a 7-day lag. And our positivity rate at that time was 5.2. To be in the lower tier, which is substantial risk, the county adjusted rate would need to go below 7, and that's about 55 a day or fewer. And the positivity rate would have to remain under 8, which has consistently been and closer right now to 4%. As of yesterday, the state released new metrics that show the following numerical changes. Panise, I don't know if you can bring that up, that'd be great. So our new unadjusted COVID-19 case per 100,000 is 6.2. Now you think about that, on the 31st, it was 7.7. The adjusted rate for the tier on the 7-day average 7-day lag is 6.0. So 6.0. So we had an outstanding week back then. It was, versus 7.8 on 8/31. Excuse me. And the positivity rate is 4.1 versus 5.2 on 8/31. So those numbers have come down substantially. So that put us in the red category for a week. The critical part will be what we did September 6th through the 12th. Because we have 1 week in the red, as all of you remember, you need 2 consecutive weeks in the red to get out of purple and into the red. So it's already in the books. We're just now waiting, and we'll know next Tuesday what we did on September 6th to September 12th. If we did well, we'll be able to move into the red. And obviously moving into the red opens up many more opportunities for businesses to operate indoors with modifications. And Penny, I don't know if you want to show that really quick, but you can see, I mean, movie theaters, indoor dining, all kinds of different things, museums, zoos, increase in mall and retail. I mean, there's a lot at stake here. Indoor activity as far as barbershops and beauty salons and all those type of things. So lots at stake there. We're hoping for the best. We feel that we're on the right path, that our testing has been above average of the state average, and we got that little bit of a bonus there because of that. So all that is important, because you need to stay, number one, for schools open, you need to stay in that red tier for at least 2 weeks. But if you have 2 consecutive weeks where you're in the purple, you move back to the purple. So even if we get to the red, we want to continue to stay in that red and move towards further opening as the numbers dictate. Just a couple of reminders. In August, Health stood up the K through 6 school request waiver. So far, 20 schools in the county have been approved. And like I said, important reminders that we have to stay vigilant. Even if we do move to the red, we have to stay vigilant. And a reminder to get that flu shot, as the flu season is upon us. Let's talk about updated county testing, because this is so important. I get a lot of requests on what are we doing about testing? What is our strategy? So until it was announced, a week ago on August 31st, really we were doing well on testing. We were beating the state average. We were being asked to do 1,200 a day. We were doing 1,800 a day, and that's why we got that little bonus, because we were doing 1,800 a day. There's currently continue to be about 1,800 with that we had to stop those 2 days because of air quality. So we're going to try to make that up. But the state has now put in a framework that's putting a premium on testing at higher levels. So the state now provides that case rate credit for counties to exceed the state testing average. And the more you exceed, the more credit you get. So even though we were above the state average, in light of the new framework, the county's revising our testing strategy to really seek and gain benefit of even higher numbers. So we are investing additional large-scale testing sites to increase our total average test by at least 500 to 750 a day. And the way we're looking at this is we're going to have one static location that can accommodate a lot of people 5 to 6 days a week. We're going to open up Saturdays to get more people in who won't be working on Saturdays. And we hope to get 1,000 people. We're going to open up a lot of lanes. We're hoping to get 1,000 people through that testing process in that 5 or 6 days. At the same time, we'll continue to use Project Baseline, and we'll move them around the county where we've been averaging 500 to 750 a day in those locations. Additionally, we are in discussions, and I think this is big, to add the capability of specifically testing children and minors at mass testing sites, so that we will have a designated lane if these negotiations go well, and that's our goal, to have a designated lane for minors that can come through and get tested as needed in our county. And this would be the first time we're able to do that on a wholesale basis at one of these mass testing sites. To this point in time, we've not been able to do that. So the county supported testing sites, of course, are only a part of the picture, and we really rely upon our healthcare. We're going to challenge our healthcare systems, Kaiser, PAMP, others out there, to really step up their testing also. and we've worked in great collaboration with them. We'll continue to work in collaboration with them. In addition, we're still investing in the highly targeted testing at communities as identified by public health. As public health sees an apartment complex or a block or an industry that's being impacted, we have these strike teams that can go in there and do immediate testing to try to get ahead of those who may be infected and get them to isolate so they don't impact others and continue to spread the COVID-19 and increase those numbers. So we're also going to continue to work with our partners in our local cities to do add-on testing that, we're partnering with them to the extent they have the capability. We're willing, we've offered to cities to go in and give them the test kits necessary, the PPE necessary, the training necessary to do testing on their own. So we're certainly working with the cities, and some cities have availed themselves of that service, and it has worked out well for them. Even if they want to do 50 a day, 40 a day, we can supply them with those kits and they can get that done. So a lot of exciting things on the testing front. We feel very good about this. We feel that the supply chains are intact now as far as the getting the testing kits out there. We also feel that the turnaround is such with more labs coming into service that we can get those turnaround times to the point where we need them to be. So all things good on the testing front. We believe that we have a strategy that will certainly get us to higher numbers, will give us higher bonus points as far as the bonus points that are given to the daily case rate by the state. And let me just say this, that we're not testing just to test. We think that testing is good. So the public needs to know with 30 or 40% asymptomatic, we need to make sure that they know if they are a carrier, a potential carrier of COVID-19. So we want to make sure that we do get this out there on a widespread basis. The JIC communications, we're trying to work closely with the cities and community-based organizations, other partners to publicize the dates, the times, and locations of testing sites, which are critical. We're getting those up on our webpage so people have time to do that. And you can help us a great deal by publicizing the information as well. We really see you as a partner in helping to get people out there to these locations. And, we're excited about what we've got in the works here, and especially about the testing of kids if parents want them tested. So we're excited about the possibilities there. We're also, the communication staff is also working with community affairs to push out the word on in regard to census. On the Great Plate program, it's going really well. It's just serving so many people to date. They've delivered 2,332 active participants with 68 restaurants involved. A lot of money coming back into the economy, a lot of jobs created. On to the census. This says 14 days left. That might not be the case. There's a temporary stay in place that may allow us more time on the census. The case is being heard tomorrow. If a permanent stay is put in place, then we'll have till October 31st. That is what we're hoping for. But we are prepared, if we have to move on and sprint through the finish line until the end of this month. So with that, I think that just the Massmobile. You want to bring up the Massmobile, Panise? I'm happy to report the Massmobile van is up and running. You can't miss this. There's a picture of the Supervisor Groom and Supervisor Horsley in front of this van. We will be using data from health in areas where we believe that that masks are in short supply or people are not using them, and we will be out there delivering masks to those areas. We're very excited about getting this on the road and out to the public. We have dates and locations that we'll be publicizing on where these the Massmobile will be. With that, let's go ahead and take some questions.
Great. Sarah Wright, you can go ahead and unmute.
Sarah, how are you?
I'm good. Thanks so much. How are you?
Good, thanks.
Is Half Moon Bay one of the cities you're looking at working with on running their own testing site?
Well, we've offered that to every city. We are in Half Moon Bay on a rotational basis, but we've offered that up to every city. If they can put that, if they can make it operational, we have the kits, the training, the PPE, the instructions. It's very simple. These are self-administered kits, but we've offered that to every city.
Great. And I heard that there was targeted testing in Pescadero last week, which uncovered quite a few cases, which upped their numbers, I think, almost double. Is that a cause for concern, or is there any other targeting for the South Coast in response to that?
Well, I'll turn it over to Sarita in a minute, but let me just say that I'm very proud of health and their ability to really look at the cases through the epidemiologists and then target locations. And I think that is key. And we have that ability to put out those strike teams to get out there very quickly and get those, work with the community-based organizations or work with the community to get those tests in place. So it's always a concern when you see a spike because you want to get out into a particular area and make sure you get out ahead of it. But Sarita, do you have more to add on that?
Well, I'll just say, Sarah, that the county supported the South Coast partners when folks were returning back from having been evacuated, having had more exposure, and having some concerns. And we really appreciate the strong partnership with Puente in standing up a testing operation in the South Coast. We don't have any further information to share, and we also really want to protect the privacy of any individual who was tested with our support. We want to make sure that that individual gets their test results from their doctor or from their test provider, and it's not something we'll be talking about with the media.
Got it. Thank you.
Yep.
Great. Henrietta J. Burrows.
Henrietta, how are you?
I am fine, thank you. And you? Fine, I'm sure.
Oh yeah, nothing but good news this week.
Good. Santa Clara County announced an order today that requires large-scale healthcare providers to provide testing. And I'm wondering, does San Mateo County feel a need for such an order? What's the situation in the county?
I think we have a very good relationship with our providers. Sarita, what are your thoughts on it?
We really value the significant role the healthcare providers play and don't have plans to issue specific orders in that regard. Every major healthcare provider is such an important resource, and they're supplying about 80% of the tests that the public health lab is receiving. We want to encourage, as we overcome the capacity constraints, the supply chain constraints, all the different avenues that individuals seeking a test can get a test.
Okay, you had mentioned, Mike, having a test for children, and you said on an as-needed basis. What does that mean? If they're symptomatic?
No, we're gonna open it up like we would to anyone else. We'd love to create a lane, and it really is dependent upon the providers. If we can get the provider to come in and operate on a 7-day or 6-day a week or 5-day a week basis, we'd love to have that up and running and continue to keep that up and running. So we're just in negotiations with that. We feel good about it. So we hope that we can do it. It may be just 1 day a week they do it or a couple days a week, but we're going to try to get as much of it as we can because we feel that there might be some pent up demand there. All
children? I mean, what age? Starting at what age?
Yeah, that's a good question. I don't know. I think potentially, if it's a mouth swab and we're not doing the nasal swab, that it could be potentially any age. I don't know if it'd be an infant. I mean, Sarita, do you have any information on that?
Well, I don't know specific about age. This is in response to residents facing some access challenges when seeking a test for a pediatric client. So that could be 2 on up.
Okay, thank you.
Great, thanks, Henrietta. Any other questions?
We don't have any. We have some chat questions, but I think we'll get back to them in writing.
Great. Thank you all so much. Again, a very some positive news this week. Good to hear. I think that I love to see these numbers down where they're at. Let's hope that next week I'll be able to come back and say that those numbers have also been positive from last week and that we're in the red. So hang in there and stay safe. We'll see you next week.